Okay, so we have a 22-year-old patient who has just been in a snowboarding incident with another snowboarder on the mountain. She collided with them, and now she's currently experiencing some bilateral neck pain, very sharp and consistent. She is currently having some relief with placing hot packs on her neck for 5 to 10 minutes at a time, but other than that, the pain is very consistent. So due to these symptoms that she's experiencing, I would place her in the neck pain category with mobility deficits because she is lacking cervical range of motion, as well as experiencing some bilateral neck pain. The patient is presenting with some sharp and dull achy pain. This is at the beginning range of motion. She is experiencing more pain with movement, so this would lead me to believe that she is in the acute phase of the mobility deficits. So moving forward from here, we're going to work with her on some cervical range of motion as well as some cervical stretching, very either passive range of motion or active range of motion. This is going to depend on patient tolerance from pain levels. We can also do some general fitness, since general fitness at this phase is always recommended, so we can get her on the bike or on the treadmill. We can also do some modalities, since she's already currently doing heat. She doesn't have any trouble with heat, so we can use some heat during treatment, as well as some upper body or upper extremity strengthening exercises. Special tests that were done on the patient was the deep neck flexor test. She did get a positive score of 12 seconds and 10 seconds. This test is to help guide us in the rehabilitation treatment moving forward to see where her baseline will be. This helps us to gain an understanding of her posture control as well as her muscular endurance, and if there's any muscular imbalance in her cervical spine, such as her superficial muscles versus her deep flexor muscles. Now that we have these test results, we can now moving forward prescribe some deep flexor endurance exercises, for instance, like the chin tuck. This, of course, would not be prescribed to her until she's in the chronic phase due to the state of her pain currently. This is something that we would work into. In this phase currently, I would not recommend having her do any of these exercises, as she is having pain just moving her head side to side. So we are going to just, for now, even just start with some isometric exercise. Exercises the patient can do currently is some isometric holds and flexion, extension, and lateral flexion. She can also do some active range of motion, which is going to be in all those directions as well. Passive range of motion is always acceptable depending on the patient's tolerance and if she can do active range of motion comfortably. Upper extremity exercises are encouraged in this stage as long as it's not aggravating her pain. So I would recommend some scapular abduction in prone, some T's or some shoulder extension in prone. Lastly, I would recommend some stretches like the levator scapular stretch, the rhomboid stretch, or even the upper trapezius stretch. Okay, so with our patient today, since she is in the acute phase of healing, we're going to work through some active range of motion of some cervical lateral flexion. We're going to do cervical flexion and extension. And we're going to go all 4 ways, just like that. We'll start with just some active range of motion. If she was having incredible pain during this, we would go then revert to some passive range of motion with her in possibly even a supine position. But for now, we're going to start with that since she can move her neck from side to side. After that, we're going to move on to the stretching phase. We'll then do some upper trapezius stretches, and that's going to look like this, where she's holding her head and placing it into lateral flexion and holding this stretch for 30 to 60 seconds. Depending on tolerance and pain, we'll do both sides. And then from there, we'll go into some general fitness. We can get her on the treadmill, walking, or biking, since general fitness at this phase of the acute phase is always recommended. The exercise I would have her do would be to lay down on the table. So I'm going to do this here. Comfortably, we'll have her in a prone position, her head supported on a pillow, and we're just going to do some extension, as well as some scapular squeezes. These 2 exercises here will just ensure that we're gaining some strength in the overall upper extremity, since she cannot really do a lot with her neck, but we'll get her moving and hopefully progressing into the subacute phase.